Today we'll be doing a MMT test for knee flexion. There's two tests involved with this. One test involves the biceps femoris, and the other test involves the two semi-muscles. So it's semimembranosus and the semitendinosus. So we're going to start with the biceps femoris first. So with a patient in prone. And so what I'm going to have you do is we're going to do knee flexion. You can take it through the motion first. But what you really want to know about this one is, and I didn't put this on your sheet, so you guys can just add this to it, that when we're doing this, you want to laterally rotate out the leg or your tibia when you're doing the motion of knee flexion, because that will isolate the biceps femoris muscle. All right, so I'm going to stabilize over the posterior aspect of the ipsilateral pelvis. And then, Kelsey, what I want you to do is, as you put your knee flexion, I want you to kind of laterally rotate your leg up like that for me. But I want you to keep your foot as neutral as possible. I don't want to do much any plantar flexion or dorsiflexion with that, okay? All right, so I'm going to go ahead, I'm going to palpate for the biceps femoris. And that's going to be on the lateral side of the leg here. Okay, so go ahead and do that for me. Yep, and that sticks right out there, okay? All right, so yep, okay, go back in that position now. We're going to add some resistance now, like that. All right, and now I'm going to go ahead and try to put you into a position of knee extension. So I'm going to try to push you down, Kelsey. Don't let me try to do that. And my resistance hand is going to be right kind of between the calf and the ankle right here. All right, so let me push you down. All right, good. All right. So then the next test is going to be the two semi-muscles. So the semimembranosus and the semitendinosus, and those are going to be more medial. So this time, what we're going to do, Kelsey, is as you go into knee flexion, you're just going to medially rotate your leg like this way. Okay. All right. So stabilize in the same spot here. I'm just going to palpate more medial. All right, go ahead. Yeah, and I can feel both those stick right out right there. All right, so same way, just hold that right there for me, Kelsey. And I'm going to resist in the same spot, and only push you down back in the knee extension. All right, good. All right, so that was a 5. All right, so now we're going to do a gravity eliminate position, and we're going to be in sideline, and we're going to be on the side that we're testing on. So this was on her left side. So I'm going to go ahead and I'm going to get a pillow here. And I'm going to come around here. Can you scoot kind of closer to the edge of the bed this way for me? All right, this is actually a really good consideration, because especially with a male and female patient, or if you're a male therapist, you know, the pelvis area is going to be kind of touching, so putting a pillow in between would be really nice to add patient comfort. All right, so I'm going to do this. I'm going to lift leg up here, and the knee's going to be fully extended, and then the hip's going to be also a neutral right here. I'm just going to kind of go ahead and relax this leg for me. And my palpating hand and my stabilizing hand is going to kind of be the same hand here. So all I'm doing is just supporting this leg with this hand. I'm going to come around. I'm going to palpate for the hamstring muscles. And if you want to, you can use a towel underneath to kind of reduce friction, but I think we'll be okay right here like this. And I'm going to come around here. I'm going to palpate the hamstring muscles. And what you do, Kelsey, is I want you to just go ahead and just do knee flexion like this for me. Okay? All right. All right, so go ahead and do that for me. All right, good. All right, go ahead and relax that for me. All right, so that was gravity eliminated. So just some considerations, some substitutions they would be hip flexors. So they were flexing their hip. They would be engaging more of the sartorius muscle. So I make sure their hip stays nice and neutral while you're doing the motion of knee flexion. And then also the gastrocs could be involved too. That's why I told Kelsey to go ahead and just keep the ankle as neutral as possible, just because if they're in strong plantar flexion, it could induce engaging gastrocs to do knee flexion. And then just the consideration would just be the pillow in between the patient.